You're watching Pyro Media Network.
But I won't, 'cause I got better things to do. Rather spend my precious time chasing somebody who loves me too. If I got $1 for every time you slam the door, I would be the richest girl alive, life. If you had $1 every time I asked you stay, you would sleep right next to me.
Thank you for tuning in. If this is your first time joining us, welcome. We hope your experience is fruitful. Please feel free to visit our website to find out how you can join our growing family. While we are loading your experience, please do us a quick favor and hit that like button from whichever platform you're watching or listening on. Also, share so others may enjoy as well. And we hope you would consider hitting that subscribe or follow button so you can check out more of our amazing content. All right, let's start the show.
Hey, happy Friday, Junior. It's Nicole D. Vick, Dr. Nicole D. Vick. Listen, I don't know why I still struggle with this. Had the same problem last episode, this episode. Dr. Nicole D. Vick. Hello. Happy Friday, Junior. So glad to have you here. I feel like this is Nicole D. Vick live after dark because it's dark outside. And we're starting a little later than normal, which, I mean, it is what it is. I'm still going to bring you the information. I'm still going to bring you the resources. We're going to have a good time. Y'all know that this month, well, first, let me back up. Every week I go live, except, with a few exceptions, to bring you important topics that are focused on the Black community with a little bit of a social health, little perspective. I'm really, really happy to have you here. Now, I done had a major health issue, and I decided that this month, because October for a lot of people is open enrollment, that I want to focus on healthcare. And of course, because I'm Black and a Black woman, it's going to be about us, right? What are some of the things that are happening, how we can work through those things, especially too from a California perspective, because I'm going to bring on someone at the end of the month that has a organization that has a statewide sort of focus on healthcare. So I wanted to talk about all things healthcare access. And one thing that popped up for me in my conversation, specifically on LinkedIn. So if you're not following me on LinkedIn, you should be. One of the things that I mentioned in one of my posts was like, nobody is asking me about my mental health. Nobody. And when I say nobody, I'm not talking about my friends and family. Like, people are like, are you okay? And I'm like, no. I'm not okay. I'm not okay. The medical professionals that I was encountering, they were not asking me if I was okay, like my mental health. They also weren't asking me about work. They weren't asking. There were so many things. I'm like, why nobody ain't asked me how I'm feeding myself? Why nobody asking me, do I feel like I deserve to be here, or if I feel down or sad? And so we're going to talk about that. And my guest today made a comment like, we need to have a conversation around the mental health aspects or issues that come up when a person is dealing with an injury or a disability or illness, injury or illness. And so I think this is going to be a really good conversation, because I also feel like in our community, specifically with Black women, there are some specific issues that many of us face that we don't see or deal with or recognize fully until we are out of commission. Right? We are not able to do things as we've done them before. And then those things start to pop up, and it's like, oh man, what is going on? So we're going to talk about that today. And we still have 2 more weeks. And so we'll have 2 more episodes focused on other aspects of healthcare. But today we're going to talk about that interesting and dynamic intersection between mental health and illness and injury. Okay. And so I have a fabulous guest on. We're just going to go ahead and bring her on. Woo woo. Come on, Dr. Brandy Florence. Hey.
Hey.
So excited to have you. I feel so blessed because I have come across so many amazing people, oftentimes by chance. And you are one of those people where I be somewhere, I don't know, some just doing something, and then, hey, how are you? What you doing? And then it's like, oh, there's some synergy there. Let's connect, right? And so I think that is just amazing. And I think I will say a testament to Black girl magic. Like we typically, for the most part, I don't know about this new generation though. I feel like this generation, we good at that. Like, girl, how you doing? What's your name? Uh,
That's because we went outside, so we know how to talk to strangers.
Exactly. So let me go ahead and read a little bit of your bio. I'm not going to read the whole thing because it is dynamic, but it's a lot. But I will say, Miss Doctor Brandy Florence is the resiliency coach, and she has over 15 years of experience in healthcare operations with expertise spanning consulting, project management, performance improvement, and healthcare administration. So very, very appropriate skill set for this conversation. Born and raised in Los Angeles, California. Hey, and still lives here. Dr. Florence earned her doctorate from the University of Southern California.
On.
Fight on. You graduated in 2020. I graduated in 2024. Your dissertation was called Missed Opportunities, Lack of Advancement of African American Females into Senior Executive Healthcare Leadership. And I will venture to say, and I wonder if you agree that some of the issues we face and see around healthcare access is because we, Black women, are not in these executive leadership roles. Because if we were, we could say, excuse me, why aren't we doing this way? Why aren't we making this more efficient? What would you say to that?
I agree. And also women. I think if more women were in leadership roles, then we look at it we from a different lens than most men do. So I think there is something that's missing in that because we're looking at big picture, not what's in front of us. We're thinking about the other things that might be going on underneath what we see.
Interesting. I also mentioned you have a book, Becoming Dynamic Stories of Women Rising to Greatness Despite Their Circumstances. Her book shares powerful stories of women overcoming obstacles and achieving greatness. Yeah, and you just got your DEI certification from Cornell. I'm thinking about doing that.
Yeah.
Really, really important certification to have, even though it's a lot of anti-DEI stuff going on these days. Folks is pushing back now. Well, you're doing too much. But I'm like, no, we need to continue to push forward. So kudos to you for that. So one of the things, I was mentioning before you came on that I had made that post that one thing that I noticed with my injury that nobody was asking me, are you okay? Are you okay? Like, how is your mental health? Nobody. And it was so interesting. I feel like I had my first or like assessment from the orthopedic surgeon that ended up doing my surgery, where I had to check in, and there's these series of questions. Do you feel helpless? Do you feel hopeless? Do you feel depressed? Do you feel anxiety? But that was not all. That wasn't until I actually met for the first time this doctor that actually did my surgery. Why do you think that disconnect happens where, yes, my ankle is broken, but like there's a whole other side of who I am besides this ankle? Like, why does nobody care? Why does that happen?
I think a lot of times the specialties are focused on the specialties, and a lot of this should happen during intake where they're doing a PHQ-9 where they're asking, and if you score a certain score, then we're alerting to say, hey, this person might be a little suicidal or have is scoring higher on the score on this test, so we might need to have the social worker come in. But in my different departments I've been in, I feel like it happens more so in the specialty. Like when I worked in OB, it was very heightened. Every visit, they're asking because of all these different changes. So it's more prevalent, I would say, in specialties. And then it's like your orthopedics, he's a surgeon. So when you're going to your regular doctor, they're just like, they're treating the symptoms. which is sad to
True.
say. But depending on the doctor, because you might have some doctors that are very thorough, very old school. And they do. I had one, and she was just talking to me, and she said, "Your thyroid is enlarged." I'm like, "What? What, ma'am?" And I did not know. And I literally have a knot in my thyroid. And I'm like, I have felt this thing for a long time, but she didn't even touch me. So I think it really just depends on the doctor or the physician in the department. But there is a lack where they're not checking in. They're not saying, hey, something's off. Like, what's going on? Like you said, yeah, my ankle is broken, but do you know who's taking care of me? Are you asking me those kind of questions when I go home? How am I managing? But I think there's a disconnect. We have the resources, but the right hand isn't always talking to the left hand, and then something gets lost.
Yeah, absolutely. And it's crazy because one of the things that for me, I feel like I probably present a certain way, right? I present that I'm okay, right?
Mhm.
I'm type A. I'm gonna do my thing. I got to make this happen. We got to be focused, whatever. But it's like for someone like me, it's like I might look okay, but I'm actually probably the one you probably for real need to pull to the side
Yeah.
because everything is on my back, and so it's so crazy. So when I had made that post to kind of, nobody's asking me, I had also did some research around that intersection between injury and illness and mental health. And I got some good context around depression, anxiety, stress, all these different things that really could pop up for a person that is dealing with changes in mobility, changes in their health, and all those things that come up. Do you think that Black women have any additional burdens, or are there any interesting things that you've seen around those issues for Black women? And I'll give you an example. For me, I said, dang, I'm the sole earner in my family. I mean, and my family right now is me and Mew Mew the cat, because my daughter is grown and gone. But if I am out and I'm down and I'm not earning no money, I can't work, everything falls. The mortgage, food, car insurance, everything, right? So I'm just wondering from your perspective, because you're also a Black woman, are there any additional burdens that kind of actually make it worse for us as we try to deal with illness or injury in regards to our mental health?
I think you kind of hit on it. It's like everything falls on you. And even, I myself, it's me and my dog. So everything falls on you. And it's just like, I got to get this done. I had foot surgery a few years ago. And it was just, I was down for like 3 months. And I felt that it was like pulling teeth to get my mother to come help me. Like she came and she cooked, and then I didn't want to eat it. And she was like, I'm going home. I'm like, wait, what? Like, I just don't want to eat it right now, mom, but I'm gonna eat it. But like having to get a ride to the doctor's office, and I don't know how to ask for help. And I will own that, and I'm trying to get so much better at it. But that's not, I just figure it out because you tell me no once, I'm gonna figure it out. So yeah, I did experience that literally. Like I can't go anywhere. I couldn't drive for like 3 months. And then my last doctor's appointment, I drove with my boot. My doctor said, "Who brought you here?" And I was like, "Me." He's like, "And you drove here in this boot?" He's like, don't do that. I was like, well, I had to get here and nobody's gonna bring me. He's like, you like stop it. But yeah, we do just have to keep going. And I think it's the stigma that we have to keep going. But I think we're in this beautiful space where we're in this space where I'm like you were saying, I think in your intro, when it's like, I'm not okay. I'm not okay, and I'm okay that I'm not okay. And I don't need you to fix me. So I
Right.
think it's a beautiful space to say, no, this I'm not okay. And I don't have to be the strong one. I don't have to show up for everyone. I don't have to. And I just don't have to. And I think for you, like you were saying, and my burden is also like when you're leadership and you're in a management role, like I'm the go-to for everything and everybody. And it's like some days it's like I don't have the capacity for me, and just being aware of that and just kind of saying, yeah, I got to take a step back, or learning
Yep.
to set those boundaries. But yeah, I do think that we have a different level, a underlying burden that might not even have a name, that we don't even know how to recognize it, but it's there.
Yeah, absolutely. Again, we often have to take care of everybody if we have kids, a spouse, or even to your point, you talked about your mom coming to help you. Sometimes we have to take care of, mom, but well, now I'm down, I can't, right? So now I
Mhm.
got to figure that out. And it becomes really hard. And I think sometimes for us, we are so used to your point, doing everything that, well, I have no choice but to. So to your point, well, I'm gonna put this boot on and I'm still drive this car. And it's like, what? And it's like you said, but who gonna do it? Who gonna take me? Right? Somebody had asked me one time about something, and I said, well, who else is gonna do it? Right? I said, I mean, he was like, wow, I forgot what it was in regards to, but it was in regards to me kind of getting around the house. I said, but who else gonna do it?
Right.
So it has to get done. Wow. Let me see. I think we can go to commercial now, and then I want to talk about support, like what you think we can do for support, and then what, because I know you have this extensive healthcare industry experience. Like, how can we streamline and make things better on the healthcare side? Because there's things that we can do, but then there's things like, well, how can we fix that? So let's go to commercial, and then we'll come back and circle back.
Okay.
Are you ready for enlightening conversations that transcend boundaries? Get ready for Conversations with Clergy, brought to you by the HIV Vaccine Trials Network. In partnership with the world's largest publicly funded international collaboration, the HVTN is dedicated to evaluating vaccines to prevent HIV and COVID-19. But their impact doesn't stop there. The HVTN is at the forefront of advancing vaccinology, social and behavioral sciences, statistics, immunology, and even contributing to the research on tuberculosis and COVID-19 vaccines. By supporting Conversations with Clergy, the HVTN not only brings you thought-provoking discussions, but also contributes to the global effort to combat infectious diseases. Tune in, stay informed, and be a part of the change. Conversations with Clergy, supported by the HVTN, empowering conversations, empowering lives. Join us in this journey of knowledge, understanding, and progress. Conversations with Clergy, proudly brought to you by the HIV Vaccine Trials Network, because together we can make a difference.
And we are back. I have Dr. Brandy Florence with me. We are talking about the intersection between mental health and injury or illness, and how sort of injury and illness can exacerbate our mental health, right? Or our mental issues. Mental health issues. Why can't I talk? What is wrong with me today? I don't know. And so we were just talking about, I think, that added burden as that Black women have, right? A lot of us are used to wearing that cape already. And so, or we're also, some of us, the sole earners in our homes. We may have children. We may have our parents that are aging. And so there's all these things that are happening in this household. And if we are ill or injured in some way, it could really just cause an added burden for our mental health, where that anxiety or that depression and those other things that kind of pop up can really be heightened. And the other thing I think that was really important that we touched on is that sometimes for us, what depression looks like for some people will not look that way for us. We will present fine. Like I feel like when I went to the doctor's office, I probably looked okay, like, yeah, hey, how you doing? Talking and engaged. But at the same time, it's like, this is a mess. What's gonna happen to me? And what's gonna happen to the, my household and all the things that I'm used to doing. So really important topics to talk about. And one of the things I think that we should be thinking about or talking about, Brandy, is what should we do? As Black women, if we are ill or injured and are suffering, what if you are at home like me, crying, 1 minute, or, eating, extra, some candy, trying to, because some of us process our mental illness issues differently. Some people eat, some people are cry, some people isolate. What should we be thinking about if we are suffering from injury or illness and realize I don't feel good. I'm not quite there yet. What's wrong? What should we be doing?
When you say what you'd be doing, are you saying as far as like your health, or are you saying just personally?
I guess both. I mean, we say whatever you think you should say, and then we can go from there. Because I don't know. Like, should we be calling somebody? Should we rely on our families? Should we call our physician? Like, I don't even know if people know what they should be thinking about if they are finding themselves overly anxious, anxiety driven, depressed because of their illness that they're trying to manage. Like, what should they be doing?
I think the first thing is like you're saying, just paying attention to, are you overeating? What little things are happening? Maybe this is the right time to start having a journal to get these out. But I think we do need to have, you have to have somebody. And I'm bad at this. I'm guilty. My therapist, I'm like, you are my somebody. He's like, no, but you need somebody else. I'm like, no, you're fine. So it's like finding that somebody who listens to you and doesn't discount you, because what I've had it where I'm sharing something and it's just dismissed. So then I shut down and say, okay, well, I'm not going to share this with you. And then we're festering with these things inside. So it's like finding someone, like you're saying, I'm not okay. And it might just be, I just need you to come sit with me today. Not that I need anything, but it's just being vulnerable in that space of I'm not okay and I do need something. And I don't like these feelings or these thoughts that I'm having. This isn't normal, because you can't move like you want to move. You can't do what you want to do. And that is depressing. And depression doesn't show up for us like it does other people. Because when you think depression, like, I can't get out the bed, they don't get out the bed, they don't do work. You're like, I go to work, I do all these things, and we're just functional. So just really being in tune with, like you were saying, my mind or what I'm thinking or how I'm feeling. And then on the flip side, the healthcare side is reaching out to your physician, but advocating for yourself. And I always tell people, if that doctor isn't working, get a new one. Like, it's real simple to say, I would like to either you file a complaint or you ask for the chief of that department to be seen, because if you get to the chief, they're going to make sure you're taken care of. Or, just advocating. If you don't have to just accept whatever it is that they're telling you. Yes, they are medical providers. Yes, they did go to school, but they do not know everything. And it's okay to say, I want a second opinion, or I don't like how this doctor treated me. I've had some, working in the system where I've had members say, I don't want to see this doctor again. And
Yeah.
okay. And then we'll get you what you need. And then they'll come back and say, thank you so much. This person hears me. Or, it's just some doctors, they just practice differently. And some are more empathetic. Some still, like I said, that old school. Some are great. And some you're just like, I think you should retire. So it just depends. Like, I have worked with a lot of different doctors. And I've had the pleasure, usually the ones that they say are the, not per se as far as like the ones that maybe staff might say, oh, that doctor is so mean, but the patients love them, but they have great bedside manner. It's like, no, he's in his zone. And you just have to understand that. So I would say a little bit of both, finding that community, and and that's just not when you're just injured or you sick, just to have it. Those are things I've been thinking about this week. I just came back from this amazing National Executive Healthcare Conference in Florida. Everybody looked like me. I said, I'm mad that I haven't joined. My cousin has been telling me for 25 years to join this organization. And it was like a sea of us. And even despite with the hurricane, and I was just in that room and I'm like, I got to change my circles. Like, so it's understanding your settings and, where you are, and navigating it. But I think for one, yeah, you got to have a go-to somebody.
Yeah. Yeah. I agree. And I think that it's really important to, like you said, don't wait until something happens to you. Then you start to be friendly and, oh, I help. Can you help me? Like somebody said something to me once, or I've read it somewhere, like make sure that you're putting with deposits into the friendship account more than you're withdrawing. So that when you do need to withdraw, people aren't like, God dog it, that girl, Nicole always got something always going on. Dang. So you always have to make sure you're putting in so that when you do need that help, you know, you don't feel like you're drawing down on people because you can wear people down. And they be like, girl, I don't want to help you. But one thing I will say about community too, that I've noticed, and this is just my reflection, and I think it is mental health related. So I think it's worth mentioning. You will be amazed and surprised at who shows up for you. Um, there's someone, hopefully he's watching. I'll have to shout, I'm gonna shout him out. John, I met John Ford on LinkedIn and he reached out to me. This was before I got hurt. And he was like, you seem like a really cool person. Can we go to lunch and hang out? And so we went to Cheesecake Factory and sat and talked and chit chat. And he was like, you are so cool. And you know, we had a really good vibe. Do you know that man? And so to your point, I met him one time and then I broke my ankle. Do you know John, who lives, I mean, easily what? Burbank, like over there, and I'm in South LA. Do you know he comes over here and take me to the doctor? He has taken me to almost all of my doctor's appointments. John, I did not know John from a can of paint prior. You see what I'm saying? So it's like, it's amazing how when you show up, right, you are that person that people will gravitate. And I'm so grateful for him. I'm grateful for everybody that has shown up for me, but I always hope to make sure that I'm being that to other people.
Yes,
So I
yes.
think that is a really important point. And this idea about vulnerability, I feel isolated. Can someone please come by and sit with me for a little bit or come check on me just for a half an hour? Because for me, I can't even really get outside of my house by myself. The way my house is set up with steps and there's an incline, I can't just like, oh, I'm about to, walk outside. I can't. I'll be done fail. So most of the time I am inside. And that can be very, depressing. There's no sunlight in here. Like it's one thing to be outside and get the sun on you. So, all those things are important. Learning to be vulnerable, learning to be open, to be friendly, and to accept help. Those are so, so very, very important. And I think you're right too about the doctors. Switch them doctors up when they ain't acting right. I had to do that, but unfortunately, it didn't work that well for me. In one instance, I was like, "You just as bad as the other one," but you just keep trying, right? You keep
Yeah. Yeah, you'll
because
find the right one, but yeah, you don't have to just accept what they're. I mean, in advocating for you, you know you, but yeah, we might not show up in pain, or I might not show up like hollering and screaming. But I mean, that's also what they're saying. Like, with women and black women or black people when they go to the doctor, our pain level is like not as high or not as low as other people. So we might not show up, but I think that stems from when we were growing up. Like, don't go in here and act a fool. So you be like, like my mother said, playing my when you go, don't you go in here touching nothing in the store. So it's like you go in there, you act like you have some sense, but just really saying, no, I don't feel well. No,
right.
I don't. And I mean, I've had to do it. And like, no, I don't. And something's wrong and we need to find out.
Yeah, because it is very easy for them to be dismissive of you,
Hmm.
um, and say, in my case, "Oh, sorry, I can't help you. Just go to the emergency room. They can take care of you. Sorry."
Hmm.
And I'm like, "That's not." And when I called the insurance company was like, "What?"
Okay,
I'm
but
like,
wait,
"What?"
let me ask you, who did you call? Like your primary care doctor, and then they said call the emergency room?
No, 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 no. So I'm gonna give you the short version to a long story. Broke it. Went to the ER. Yep, it's broken. They took the x-rays and stuff, put a splint on it. They said, you got to follow up because they have to fix this with surgery. So you got to go follow up with your doctor and do all your thing. Saw my primary care physician. He said, yes, it's broken. He didn't even take the bandage off. He was like, yep, okay, well, let me write your referral to to orthopedist. Okay. First orthopedist. Oh, yeah, this injury is real bad. You broke your ankle real bad. I can't fix this. Let me send you to orthopedist number two. Orthopedist number two was like, oh, hi, who are you? I'm like, you don't have my x-rays? No, I don't know who you are. And I'm like frustrated. And he's like, well, you can go to the emergency room. And I was like, that don't sound right. So I called Blue Cross and she was like, no, that's not right. I said, well, give me another doctor to your point. So they gave me another doctor, but he's in the same medical group.
Mm.
So I see him. So at this point, to your point, I'm anxious. I'm like, what's the problem? So I go to see this doctor. Yep, your injury's too old. Yeah, you know what? I don't feel comfortable treating you. Go to the emergency room. So I went to the emergency room at that point, and because they told me to go to one or two emergency rooms, UCLA or Cedars. So I went to Cedars. I mean, I don't know. Okay. Cedars was like, baby, you can't stay here. Your medical group does not have a contract with us. You cannot stay here. So at 2 o'clock in the morning, they put me in an ambulance and took me to a small little hospital in Downey or Norwalk or somewhere. Stayed there for 2 days. They were like, girl, we have to discharge you because I don't know what's going on. We can't get you no help by. And they sent me in the ambulance right back to my house.
How long was it before you actually had surgery?
104 days from the day I broke it. 104 days. Two, one primary care physician, well, a total of two primary care physicians, four orthopedic surgeons. So what I had to do, I called Blue Cross back after I got back from on the ambulance back to the house. They just dropped me off. I said, what is going on? And she was like, let's change your medical group. So they changed my medical group to Cedar Sinai Medical Group. Saw that orthopedic surgeon on a Thursday and had a surgery date on Friday.
Yes, see, that is should be like I wasn't expecting 104. I know you said it was a while, but not 104. So at this point, they got to re-break it because it had healed wrong. So they had to
Correct.
break it, and I'm sure you had to get some pins and all those great
Oh
things.
yeah, I'll send you a picture of it. You see, I should one. You know what? Next episode, I'll have to remind my producer. I'm gonna put the picture of my X-ray on there so we can see my screws and pins in my ankle. But it's
Yeah,
just so
I like
crazy.
because of this, what the healthcare system I work for, it is integrated, so it's all that wouldn't have happened. It wouldn't have been that much of a delay. It's in the system when you go see the next one, and they're able to look at it. I mean, that was the whole point of this whole electronic medical record. But if you're not in the same medical group, I don't know how that works. But yeah, that is unacceptable. And
And let me just say this: my original primary care physician. They called me some months later, because they know what happened. They called some months later. Oh, is everything okay? I said no. I said it's still broken. I said, I just want to let you know I'm not happy with how this whole thing played out. And the secretary said, well, I guess medical assistant said, yeah, we often tell our patients to switch medical groups because this one is really bad. And I said, I wish I had a record. I didn't say it to her. I said, I wish I had recorded that. I wish I had recorded you saying that
well,
because
that's
you didn't tell me that.
your insurance company so they can stop sending people there because that is a lawsuit. And I'm sure it's a few lawsuits that have happened. Yeah, it should not have. That is the ultimate delay in care, and that is what
Crazy.
they want to avoid.
Right.
Mhm.
So anyway,
Okay, I
so
didn't
again, so
hear
even for
it.
me with my mental health, right? So it was the trauma and the anxiety around learning how to manage and live and survive with an injury. One,
Mhm,
the trauma and all the anxiety around trying to navigate a healthcare system that don't make no sense. Right?
mhm.
I'm like, why is this happening? Why am I going from here, and nothing's happening? And then I'm also trying to be on the phone with the insurance company. So it's like all of those things are layered. And I'm like, nobody was like, Nicole, you okay? And so I think that's why I really wanted to talk about that intersection because it's really important. And then let's talk about this. So say you're not the injured person, you're the family member, you're the friend. I'm thinking, is there any things or thoughts about how they can be sure that they're checking in? Because for me, I feel like when the injury first happens, that's when everybody kind of surrounds you and how can I help you? How can I help you? But then, and I'm not mad at this. People have their own lives and they have their own set of things to do. But I just wonder if there's any other suggestions or thoughts about the folks that are surrounding this person, how they can be helpful as they try to navigate the injury or the illness and the mental health issues that come up.
I think it goes back to what I was saying. Is like you got to just let them know because nobody, it's like, oh, it's kind of like the funeral. When the funeral's over, there everybody's around that first week, and then when I need you on my first Mother's Day or Christmas, it's like crickets. So yours, because it was so long to even get the treatment, it's like, oh yeah, but this is your ankle. I can't move. I'm like, this wasn't my pinky finger, and I can still do everything. So yeah. I mean, it sounds
Yeah.
like sometimes it happens from those outside people, like John, like you mentioned, not the ones that are the closest to you, because we show up so strong and we have it together and we'll figure it out. So they say she got it. And
Yeah.
because you're not calling and saying, I need something or help me, it's like, oh, she's good. So that whole thing going around lately, check on your strong friends. Like, it's almost like when they get too quiet. Like, I have certain friends that just will hit me up out of the blue, and I'm like, God was talking to you. Because they know I'll just get quiet. I'm in my corner. I mean, I was an only child for 16 years. So I would just shut down and be like, I got
Yeah.
to figure it out. And
Yeah.
that's something I'm trying to be better at. So, yeah, it's just being honest about what you need as it goes on.
Yes. I think that's an important lesson. For me, it was to ask for help and to
Hmm.
be okay with that, and be vulnerable in that way. That was super, super important. And you do have to let people know. And I actually even heard, to your point, I heard people called me and said, "Oh my gosh, Nicole, I didn't realize that this was the extent of what this was, and I am so sorry." And I was like, "Well, you don't have to apologize." But they were like, "If I had known," because I think also, for example, for me, people thought, "Oh, I thought Andrea, my daughter, I thought Andrea was here," because she had moved in with me during the pandemic, and they thought Andrea was here. She's almost 28. Andrea moved to Arizona like 6 months to 8 months ago. Andrea is gone. It's like I said, me and Mew Mew the cat, and Mew Mew the cat can't do nothing but ask me to feed her. That's all Mew Mew the cat is good for. So, and people were like, "Oh, I thought Andrea was weird." No, it's me
Yeah,
with
because you
crutches
weren't
trying
saying
to
anything.
figure
Yeah,
out how to get around
you
the
were
house.
quiet. Yeah, you were quiet. So they assume, oh, she got help. She got it. She got it. Which is like, you did have it. You figured it out, but you didn't have it.
I did, but I didn't.
Right, right.
And then how can the healthcare industry do better? I know we talked a little bit about providers and sort of maybe they can, make sure they're doing those screenings. Like I said, now every time I go to see this particular surgeon, I notice, and I do my pre-check, and I notice those series of questions. How often do you feel helpless? How often do you feel this way? But are there other things at the provider level or even higher than that? What can they be doing to make sure that when people are ill or injured, their mental health doesn't suffer?
That's that's the problem, because a lot of it, like, I feel like some of the organizations, the bigger they get, the more disconnected they are. And it's about the system and being in tune. And it's when you start hearing from the members, like some medical groups actually have like patient advocate groups
Mm,
where you can, like, let's hear what the patient really wants and not what we think the patient wants. Because we can say this is what they need, this is what it looks like. But when you hear from the actual patient or the family members, to say, no, this is not it. And if you would have asked me this, then we would have gotten here, or it looks like this to me, versus you thought it worked this way. So I think a lot of companies have started to do that, because you need to hear from your customer. The member is the customer. And
right,
I
right.
mean, and because you do get the ones, so it's like you get the ones that are over the top, or we call them the frequent flyers that abuse the system, and then you have the ones that rarely use the system. So it's like getting stuck in the middle of which one it is. But I don't. I wish I had a great answer, but it does start from the top down. But if enough member complaints, or your insurance or your company, they start pulling back, then they'll have to adjust and change. But it starts with just saying, this is what I need, or maybe I don't even know what I need. But there's so much stuff that sometimes you'll get overloaded with information that it gets lost, or
Yeah,
other times you get no information.
yeah, yeah. Well, I heard patient navigators. So, I like to your point. I don't know if all health plans have those, but that sounds like, at least maybe from a patient perspective, to ask, are there patient navigators here, or caseworkers or social workers that can help? Because I think in my case that would have been helpful, right?
Mhm.
Because I went from doctor to doctor, and some of that information didn't transfer over. My X-rays didn't make it from this one to this one, but I had to call Blue Cross and say, "Excuse me, can you make sure this X-ray?" And they did that for me. Thankful for them. But I'm like, dang, like simple
Yeah.
things to me. And I feel like, to your point, there needed to be someone that was looking at the whole thing, right? Because I'm doctor to doctor, and each of those doctors aren't talking to each other. No one was looking at the bigger picture, right? Like, what is happening right now, and how can we right this wrong?
Right.
So I heard you say patient navigators, and complaining. filing grievances if you feel like what's happening isn't happening correctly. And I remember Blue Cross offering, hey, would you like to file a grievance? And they actually took it in real time over the phone.
Mm-hmm.
And other than that, like you said, outside of sort of a large scale sort of shift, I don't know if things will get any better. Hopefully so at some point. But I'm really glad we had this conversation because I think it was really, really important. Before we close out, can you talk to me about your business? Are you offering services? How can people, connect with you and whatnot?
So you can find me on Instagram at Dr. Brandy Florence. I can't remember what my TikTok is. I think I might have changed it, with all these different names. I'm trying to get consistent with it. I actually have a online course, a five module course. We're teaching people how to get unstuck and really like get focused and set your goals. But really, right now it's Instagram. I'm reviving the system, the website. But yes, I do one-on-one coaching. I'm looking to maybe start some group coaching and different avenues. Maybe write another book. Not sure, because I co-wrote that book. But I mean, my friends are like, okay, so when's your book coming out? I'm like, whew, okay. So, but yes, I do offer coaching. Transitioning into speaking as well. That is the next chapter, this next season that I'm trying to transition into. But yes, you can reach me on Instagram, and then I can help you navigate the different sites from there.
Awesome. Awesome. I'm so glad that we had this conversation. We have been talking for a while about how we can kind of get together and make something happen. So I'm really glad that we did. And I'm glad that I went to that mixer that day at USC and you was there and we started talking. So, I mean, I'm one of them kind of people. I always make a friend. You would never see me. One of my friends calls me the mayor. She's like, I swear to goodness be, everybody. And I'm like, no, I don't. But sometimes stuff happens. And she was like, Nicole, again, everybody. A quick story. She was at a restaurant and she was texting me. She said, Nicole, I'm sitting next to this other Black woman and she's talking about running a marathon. I forgot where, somewhere out of the country. And oh my gosh, it sounds so amazing. She's really, having this really cool life. I said, you better go talk to her. And so she got up the courage to speak to this woman. And then she never told me the woman's name. Time passes. She says, hey, the lady sent me this flyer to this event. And so she sends me the flyer. I said, girl, you was over there talking to da-da-da-da-da. She was like, Nicole, you know everybody. And I knew who she was. I texted the girl. I said, oh, you met my friend Josie. And she was like, Nicole.
Yeah, you're like my cousin April. I'd be like, you know everybody. I was at a mixer and the girl said she worked at Southern for Edison, and I said, oh, or the gas company, one of those. And I'm like, I bet you know. And she's like, oh my God, I had a selfie with her. We had lunch. She said, I said, I can't go nowhere. We were out and everybody was stopping her. So, but that's just when you have good energy and good people and you different circles. But yes, I always say I've never met a stranger.
Exactly. So I'm glad we connected, and for sure we can probably have a future episode because there's always stuff going on. If you have any ideas about that, let me know, and we can get on here and have a good old conversation.
I'm open.
Okay, well then, all right then. All right, so thank you for joining, and everyone else, thank you for watching. You know where to find me. My website is www.NicoleDVick.com. I got all my stuff on there, my podcast episodes for this podcast, and then I also have a Spotify playlist of podcasts that I have been a guest on. You can find my book all up on that website. Actually, I said book. I have more than one book. I have my first book, Pushing Through, Finding the Light in Every Lesson. My second one, Push Through 52 Weeks of Light in Tough Times. And then I have that fabulous anthology, Triumph in the Trenches. That one is super cool because it's about helping Black folks navigate the working world because it is rough out here for us. And then you can follow me on social media. All my social medias are the same, Nicole D. Vick. I'm not really on social media lately. My mental health ain't all. I'm not 100%. I'm not feeling it right now. So, but sometimes I'll pop up and say something, pop out and show some people, and then I'll go back in. And hopefully soon I'll be back to myself. But anyway, you have a good night. Thank you, Dr. Florence, for being here.
Thank you.
And we will see you next week. Bye.
Thank you for watching Pyro Media Network. For more information, please visit pyromedianetwork.com.